Hi, good afternoon, and welcome to a wellness moment from 3D Integrated Medical. I'm Dr. Ed Traum, and in the wellness moment, we try to talk about topics of interest to us who are concerned about our health and well-being. Today, I am going to just do a short little talk about a patient who had lateral epicondylitis, the dreaded lateral elbow pain that we often refer to as tennis elbow. Now, typically in the treatment of tennis elbow, what you will see is therapists doing stretches, doing exercises, doing a hot compress or a cold compress onto the elbow, the lateral aspect of the elbow, or they will attack it directly at the site of pain, right where it hurts. You will also see acupuncture being done, dry needling, stabbing that spot over and over and over. Or you'll see cortisone injections into that spot, which, while cortisone is or was considered the miracle drug because it was such an extremely strong anti-inflammatory, it is also unstoppably degenerative as a therapy. It causes tissue to degrade. There's no disputing that. So those are therapies that are target focused. They are addressing the site of pain, the chief complaint of the patient, right on the elbow. What I have found in my 20 years of practice that oftentimes tennis elbow is coming from something remote. It's not necessarily a tendonitis created from a repetitive stress in that lateral elbow area. So I've had many patients, dozens of patients, and what I have come to find is that if you're not looking at the hand and the shoulder, you're doing a disservice to your patient. So often, what creates this tension in the elbow is hypertension or a distortion of tension balance throughout the forearm, into the hand, and above the elbow too, into the shoulder area. This patient I had the other day had long-term lateral epicondylitis, and this person is a hard-working firefighter, and he is also a hard-working construction guy. He does framing, he does gypsum, he does texturing, and he's constantly working. He works out a lot too, lifts a lot of weight, so his muscles are very overworked. But he had been getting therapy on the lateral aspect of his elbow, which is common practice. In fact, you could probably say that is standard of care or best practice. But what do you do when it doesn't work? You look somewhere else. You go outside of the standard of care. I looked at his hand, and specifically I looked right here in between his thumb and his first finger here. I looked on the medial aspect of his flexor group, the muscles that flex your wrist down. And then I looked up here on the outside of the shoulder, right up in this region. What I found was he had exquisite pain in those three areas, which made his whole hand go numb and made him feel nauseous. And it was quite painful. I had to back off my therapeutic pressure. But the interesting thing was that he not only had pain, his complaint was that he had pain in his elbow, but he was also having a lot of numbness in his hand right through here, and it was waking him up at night with severe pain. Interesting. No trauma to the hand, but that's where he was feeling his pain. He had seen a hand doctor who suggested he had carpal tunnel surgery. Boy, wouldn't that have been a mistake. I treated him one time in those 3 points for about 8 minutes. And while it was uncomfortable for him, he had immediate relief, upwards of about 50%. And within 2 days, he had 90% relief. I talked with him 5 days later, and he had good relief still, but a little bit of return of symptoms into these fingers, just a little bit of the numbness. So I treated him a second time in that same spot. I gave him more dosage into those points. And what I had found initially and secondarily was the tissue, the fascial tissue was very thick and very dense, and it created a lot of pain, and it referred, as I said, numbness and pain into his hands, or his right hand. So the message here is, if you're having continuous pain and whatever therapist you're going to, is if they're treating that side of pain and you keep going back and back and you're not getting 50 to 80% better within, say, 3 to 5 treatments, you need to be looking elsewhere. You need to try fascial manipulation. This is my specialty at 3D Integrated Medical, and I invite you to come and explore that. If you have something that continues to come back and haunt you, the therapy's not working for you. So there's two things. It's the wrong therapy, or the pathology is too advanced. We can talk about that stuff later. Thanks for coming. Hope you have a great afternoon. Hope you got something out of the video. We'll talk next time.